Ladies and gentlemen, please welcome your 2017 American Academy of Nursing Living Legends. Linda R. Cronenwett. Elaine L. Larson. Carolyn Williams. Nancy Fugate Woods. Connie Henke Yarbrough. And please welcome back to the stage the President of the American Academy of Nursing, Bobby Berkowitz, and President-elect Karen Cox.
All right, this is what you're here for. Yeah. Welcome, ladies. So this evening, we are thrilled to recognize 5 living legends whose vision, leadership, and contributions have shaped and advanced the nursing profession. It is my pleasure to introduce tonight's first 2017 Living Legend, Linda Cronenwett. So Dr. Cronenwett is renowned for leadership in improving healthcare quality and safety, promoting advanced nursing practice, and integrating research, education, and nursing practice. One of the early pioneers of translating research into practice, Dr. Cronenwett bridges theory and clinical problems in order to improve outcomes. Currently, Professor, University of North Carolina, Chapel Hill, and co-director, Robert Wood Johnson Foundation Executive Nurse Fellows Program, Dr. Cronenwett serves on many national healthcare boards and councils, and her work has been honored with several significant awards. At a time when there were no established vehicles to guide and move evidence-based practice forward, she served as Director of Research at Dartmouth-Hitchcock Medical Center and was responsible for facilitating research utilization, academic affiliations, and quality improvement. Dr. Cronenwett was appointed to the NIH National Advisory Council for Nursing Research and became a significant voice for preparing nurse researchers with expertise to translate research into practice. In the field of nursing education, Dr. Cronenwett has few peers. She launched a national movement when she led the Quality and Safety Education in Nursing Initiative for more than 8 years. This initiative revolutionized nursing education, strengthened academic service partnerships, and continues to improve the quality and safety of patient care. As a result of Dr. Cronenwett's work and her leadership in creating a movement that would engage hundreds of nursing clinicians and educators across the country, QSEN's impact has spread widely to curricula, textbooks, and interdisciplinary projects. The Cronenwett et al. 2007 seminal publication describing QSEN initiative with the competencies and requisite knowledge, skills, and attitudes has been cited 684 publications around the world. Linda Cronenwett's contributions to nursing extend to her leadership as co-director of the Robert Wood Johnson Foundation Executive Nurse Fellows Program, an innovative leadership curriculum. Under her direction, the program has been redesigned as an active living curriculum that includes a mentor relationship with each of the 20 fellows who enter each year. For more than 30 years, Dr. Cronenwett has made extraordinary contributions to advancing nursing practice. She challenged the profession to develop a coherent sense of advanced practice nursing and published widely on the subject. Her article, Molding the Future of Advanced Practice Nursing, published in Nursing Outlook in 1995, was one of the early calls for working towards consistency in regulation and education of advanced practice nursing and represents her work as a thought leader in this area. One of Dr. Cronenwet's sponsors, Dr. Jane Barnsteiner, will tell us more.
Linda has been a tremendous friend and colleague since we met in 1980 in our doctoral program. We've had the opportunity to work together on many initiatives. She's provided me with many opportunities to also develop my own skills. And she truly is one of the most outstanding people that I've ever encountered in this profession. I've been privileged to work with Linda on a number of initiatives, and what I find most inspiring about her is her professional generosity. She casts a wide net of inclusivity when she's pulling people in to work with her on numerous projects, folks not just nationally, but internationally. And she's always willingly shares her knowledge and expertise. Linda has obviously inspired many other people also, if her more than 24 honors and award are any indication. She was inducted in the Academy in 1988. She received a Founders Award from Sigma Theta Tau for fostering professional standards. She received the President's Award from the American Academy of Nursing. She received the inaugural Linda Cronenwet Leadership Award from the CUSIN Foundation, based at Case Western Reserve. She also received an honorary doctorate from the University of Nebraska Medical Center, and she received the ANA Jesse Scott Award. Linda deserves to be a living legend because from her service in the military at the beginning of her career, to her many leadership roles throughout her career, to the continuous influence that she now provides on the many boards that she serves on, she's lived the ideal of a sustained contribution to the profession, and she really has served us so very well. Linda walks into a room and absolutely has a very positive presence. She has a bounding laugh that everyone would recognize. She is willing to step up to the plate for any challenge. She has been a fantastic, intelligent voice for nursing. She doesn't get mired down in the politics. It's always around what's going to be best for either students or what's going to be best for patients and families. And that's the direction that we should move towards.
Please join me.
I've always valued Saturday mornings at the Academy when we speak the names of the people who have passed. And I always figured that would be the next time you heard my name. And to say that to be a living legend is a culmination of a totally different sort doesn't cover it. Thank you, Academy Selection Committee and Board of Directors, for this honor. And thank you to the three dear colleagues and friends who nominated me for this award. Sudeen Bar for sharing with me many years of working together on practice policy issues with the American Nurses Association. Shirley Chater, whose mentorship is such a treasure in my life. She taught me nursing leadership in my master's program, the one semester I was at UCSF, and then for the last 8 years, she's been my mentor with the Executive Nurse Fellows Program. And to Jane Barnsteiner, dear doctoral student friend for life since our days at Michigan, one of the cadre of CUSIN leaders who continues to shepherd the changes in quality and safety education we initiated during this last decade. Thanks so much for the pleasure my family and I have this evening. I'm delighted to share tonight with my daughters, Sarah and Molly, and my spouse of the last 24 years, Shirley Tuller, They've been by my side during my career, experiencing both the thrills and challenges and the frequent absences from home that have accompanied my work. They and our amazing extended family, including granddaughters, my mother still living and my father just gone, my siblings and their families are the central joy of my life, and I acknowledge tremendous privilege in this regard. I wanted to be a nurse ever since I can remember. A beloved nurse neighbor inspired my early dreams, and others led me onward. The faculty and deans at Michigan and Washington nurtured a love for both the science and the practice of nursing. Early editors, Florence Downs and Harriet Worley, seemed to take me as a personal cause and either honestly or mercilessly, depending on my mood, edited my work but insisted that I publish. Through my scholarship, I came to know precious role models like Jane Norbeck, Margaretta Stiles, Angela McBride, Bev Malone, Norma Lang. They were out to change the worlds of nursing and healthcare. They led our professional organizations and professional practice policy development, and I began to assume that maybe I should contribute as well. Dartmouth-Hitchcock Medical Center leaders Marilyn Prouty and Jim Barnum reopened for me the worlds of nursing practice and healthcare. Paul Batalden, one of the earliest leaders in quality improvement, came to Dartmouth as well and became my lifelong mentor in quality and safety education. And during this last decade of my career, I'm indebted to George Thibault, who will become an honorary fellow at the Academy Saturday night, for the many doors he opened to lead in interprofessional initiatives and boards. And I'm also grateful to Cindy Friend and Bill Roper, the Deans of Nursing and Medicine, who brought me to UNC Chapel Hill with the university and the faculty I've loved now for almost 20 years. 5 faculty members whom I hired to UNC over a decade ago are being inducted Saturday night, and that makes this academy really special. There are so many more people I should mention. I'm incredibly honored to share this evening with these other nursing legends here who have been part of the history of my long career, all the way back to when Nancy Woods and I were in our master's program together at Washington in 1968. And to those of you in the audience, so many of whom have been part of my nursing career, executive nurse fellows, alumni family, thank you for sharpening my thinking and inspiring me with your spirit and insights and love for the profession. I can't name you all, but this honor means all the more for your place in my heart. So for those of you out there who are in the midst of your own legendary careers, here are the takeaways from my brief remarks. You're mentoring others and you might not even know it, so be generous with your inspiration and encouragement. Even those of us who have 50-plus year careers continue to seek and learn from mentors and peers, so never quit learning. And you need colleagues who are friends and friends who are colleagues, who inspire and challenge and goad you to be the best you can be. You need those same friends in your family to provide ballast when you stumble on the journey, as we all do. I've been privileged to have these gifts to meld with my own in service of this profession that we all love. And I thank you so much. I was going to say for my final honor, but at 11 p.m. last night, Shirley Chater said, you take that word final out of there. Thank you very much.
Our next 2017 Living Legend to be recognized is Elaine Larson. Dr. Elaine Larson is one of the world's leading experts in infection prevention, antimicrobial resistance, and hand hygiene. Her contributions have changed the way healthcare is delivered by emphasizing the importance of infection prevention and hand hygiene for all health professionals. Currently, Professor and Associate Dean for Research at Columbia University School of Nursing and Mailman School of Public Health, Dr. Larson has published over 500 scholarly publications, served on prestigious national advisory boards, and has been the editor of the American Journal of Infection Control since 1995. Elaine Larson has been described as a visionary, focused, persistent, determined, tireless in her work, and generous with her time. Her work on hand washing has contributed to the evidence that supports the hand washing behavior expected, even required, of personnel coming in contact with patients. Her work has improved the quality and safety of patients worldwide and helped modernize healthcare and transform the way hand hygiene is practiced. Dr. Larson has conducted interdisciplinary work to address pressing public health problems, including hospital infection prevention, hand hygiene, HIV/AIDS, antibiotic and pandemic influenza. She has been asked to serve on review panels and is an expert advisor to the Centers for Disease Control and Prevention. President Bill Clinton appointed her to the Presidential Advisory Committee on Gulf War Veterans Illness. As an educator, Dr. Larson has made significant contributions to mentoring future nurse researchers. Probably half of you in this room were mentored by Dr. Larson. She has mentored countless infection control nurses, some of whom are emerging as leaders in clinical research. Dr. Larson recently completed training in interdisciplinary research on antimicrobial resistance. That's a tough one to say. A 10-year funded program at Columbia University that supports pre- and postdoctoral fellows to engage in research and gain experience working on interdisciplinary research teams. Graduates of this program now hold positions in industry, hospital leadership, and academia. As editor-in-chief of the American Journal of Infection Control, Dr. Larson has overseen the growth of publication from publishing 60 papers per year to over 300 papers in 2015. She has served on the editorial boards of 14 journals and has been a reviewer for countless high-impact journals. Elaine Larson's profound contributions to nursing and infection prevention has advanced science, improved policy, enhanced patient safety, and transformed the career of clinicians and researchers. Let's hear more from Mary Lou Manning.
I met Elaine 12 years ago, but have been following her work since 1984, when she published a book on infection control and microbiology. So it was that book that actually influenced both my professional direction and my academic direction, as well as Elaine's later writings in all of these varying topics. When I did get to meet her, I knew I was in the presence of a rock star, a nursing rock star, because she was brilliant, she was engaging, and she was so incredibly gracious with her time. Elaine is an extraordinary role model for nursing because she just exudes a joy and a passion and a commitment to advancing nursing across the region, the nation, and the globe. The hallmark of her career has been in mentoring of both her colleagues, me included, as well as just hundreds of students over her career. She exudes this positive energy all of the time. So no matter when you see her, no matter when you talk to her, there's just this energy that exudes from her that you do nothing but want to be energized as well. So she really motivates people. Elaine is widely recognized as one of the world-leading experts on hand hygiene and infection prevention and control and the prevention of antimicrobial resistance. So her work has been groundbreaking and has influenced nurses and healthcare providers and public health across the globe. She's published over 500 papers. She has had 70 grants that are funded from all different kinds of sources. She is just incredibly productive, but she brings people along with her. So she's very inclusive, both of nurses and all the other disciplines. She just has this aura of wanting to energize others and be with others, whether it's nursing practice, whether it's nursing research, whether it's nursing policy, whether it's nursing education. And so she's got it all. So she's the whole package. And it's fun to watch at conferences because a lot of her, both current students and previous students, all clamor around her and want to be with her. And it's almost like touch her. It's pretty dynamite to watch. Elaine exemplifies the characteristics that the Academy Living Legend Award wants to honor. She is dedicated to the profession. She has made enormous contributions over her entire lifespan and continues to do so. She's not slowing down in any way, shape, or form that I can see, and I am just happy, delighted, and gleeful that I'm here to share this with her.
I think when Bobby said I was determined, I think it was a nice way to say stubborn. And I'm actually embarrassed because I'm supposed to be a great infection control person, and here I am sounding not so good. But my physician assured me that no, I'm not really infectious to anybody else, just to myself. It's my own normal flora. So, but just to be careful, I'm not going to shake your hand or give you a hug tonight. So. First, I don't know if you noticed, but I wanted to let you know that I'm wearing the outfit, this outfit, because it was the same one I wore in 1982 in my induction 35 years ago. So, the lesson is that it's, people and clothes can age, hopefully in a good way. All right. I'm reminded of this because for several years, some of my colleagues asked me about whether I was willing to be nominated as a living legend, but I said no, because a living legend, I think, has two major criteria. First, you have to have done something notable and lasting in your profession. And secondly, you need to be old. Sorry, ladies. But when some of my peers and colleagues started becoming living legends, I decided that I had met one of the criteria. So, and these clothes remind me too. So my deepest thanks to Tim Landers, who initiated the nominating process along with other colleagues who contributed, Mary Lou, Martha Hill, Jason Farley, Beverly Malone, and additionally, thanks to my boss, Bobby, and my Columbia colleagues for helping to make the job just something that I look forward to and value every day. Somewhat to my delight, but also my embarrassment, I have a wonderful bunch of family here. I'm very grateful to them. My husband, Steve, of 53 years, he's here, as he always is when it matters. And thanks for my daughter-in-law, my daughter and son-in-law, Justine and Chapin, and our two oldest grandchildren, Evelyn and Nate, and little Stella, who's the youngest, four months old. So in addition, my sister-in-law and brother-in-law, Jane and Greg, are here. I'm so grateful for them as well. And my nephew, Chris, and his husband, Jeremy, thank you for coming, and our good friend, Robert. So thank you very much. It was some of my early work along with that of colleagues in the US, Europe, and Asia that resulted in one of the transitions in patient care and public practice, that is using hand sanitizers rather than traditional hand washing. When I proposed to study hand hygiene for my PhD, my professors told me that infectious diseases were pretty much conquered, and I should focus on something like cancer or heart disease. So I had a hard time actually convincing them that it was okay to study infectious diseases. I had to work hard to convince them, and then I published with great trepidation in 1980s studies showing that alcohol-based products were more effective, cheaper, and actually easier on the skin than soap and water, something that is not at all intuitive and completely against standard practice at that time. Initially, the work was barely noticed, and when it was with skepticism and not much enthusiasm. For example, when I published the first U.S. study suggesting that traditional surgical scrub, like you saw on ER, didn't work very well, wasn't very effective, and it needed to be changed, surgeons were, to say the least, skeptical and sometimes hostile. Even infection control nurses early on said that we shouldn't use sanitizers because it would keep people from washing their hands, sort of the train and transportation business over again. And rather than the idea that the outcome is really to reduce the transmission of infections, not just the process of washing your hands. It never occurred to me that the dramatic change and now widespread use of hand sanitizers by clinicians and the public would actually happen. It's a very tiny contribution, but one that is made for an interesting career. Anyway, I'm certain that in the future, new and better ways of preventing infections will be discovered, and I hope for the perspective and wisdom to welcome those new ideas. I want to end with 2 words of wisdom from philosophical sources, the first one being the New York City subway. A poem. A strange woman met me in the mirror last night. "Hey," I said, "what are you doing here?" She asked me the same thing. So I try to ask myself what I'm doing here every day. I have no regrets, but if I were given do-overs, I would take more risks, I would think bigger, worry less about what others thought about me and more about what I thought about myself. And finally, another philosophic statement from a coffee mug at Whole Foods. Yesterday is history, tomorrow is mystery, today is a gift. Thank you.
Our third living legend to be recognized is Carolyn Williams. The work of Dr. Carolyn Williams has changed nursing history in the development of community and population health research, the launch of a new clinical doctorate, and the advocacy for what we know today as the National Institute for Nursing Research. As a leader, Dr. Williams believes in stimulating scholarly debate about new ideas through publication. She's a prolific writer, author, and reached innumerable nurses and other health professionals through her many papers. She is known for her work in the area of population-focused nursing and leadership. This was novel thinking at the time. In a seminal 1977 paper on the subject Community Health Nursing, What Is It?, published in Nursing Outlook, she took the position that concern for populations and designing care delivery strategies that improved health for populations was the cornerstone of community health. She recognized that designing policies, developing programs, and assessing whether these interventions made a difference were complex skills and demanded a clinical nursing focus on the population as the level of analysis. Her work truly foreshadowed our current emphasis on population health. Dr. Williams served as the Dean of the University of Kentucky College of Nursing from 1984 to 2006. It was here that she operationalized her thinking about population-focused care with her development of the Doctor of Nursing Practice program, which prepares nurses at the highest level of systems change and population-focused clinical leadership, extending this important focus to national dialogue about DNP curricular and outcomes. Dr. Williams was an early advocate for nursing research and had displayed a tremendous commitment to advancing nursing science. In 1979, Dr. Williams served as a member of a committee that produced recommendations published by the Institute of Medicine to establish a National Center for Nursing Research. She remained actively involved in this issue, including advocating for congressional legislation that ultimately established the National Center for Nursing Research in 1986. As we all know, this center is now the National Institute for Nursing Research. Throughout this lengthy effort, Dr. Williams knew that such an infrastructure was essential to move the field forward and benefit the public. A former American Academy of Nursing president, Dr. Carolyn Williams is an inspiration, a nurse who leads with conviction, passion, and thoughtful analysis. And now, Dr. Marcia Stanhope, one of Dr. Williams' sponsors, has more to add.
Carolyn Williams graduated from Texas Woman's University with honors in 1961, and she accepted a position at that time as a public health nurse in Dallas County, Texas, visiting mothers and new babies, often in the rural areas of the county, as well as in clinics housed in local churches. The one thing that she has focused on is paying forward and helping others to develop their careers, whether it be at the national level or the local level. She has a number of mentees throughout the United States who have made excellent contributions to nursing and to healthcare. And she knows how to work with people in a gentle, compassionate way. She has worked with the World Health Organization internationally in a number of locations, working with schools of nursing and schools of public health. She has also worked with one of our assistant secretaries to develop what we now know and still work with today as the U.S. Preventive Services Task Force Guidelines for Primary Care. There were 2 new nursing programs developed while she was with the American Association of Colleges of Nursing. And these programs have grown over time and have made considerable impact in graduate education. She was very early in her recognition that working with populations and advocates was going to make more of a difference in healthcare for all of us. That work lives today. It's been reprinted a number of times, and she has just recently published a new paper in the Encyclopedia of Nursing Research. She was an inspiration to me from the very beginning, because when I first applied to Emory University for the master's program in public health nursing, the faculty were not sure that I had had enough content in my undergraduate integrated curriculum program. Rather than taking the transcript at face value, she called colleagues. She went beyond what she really needed to do in order to assist me as a young student. She found that I had had ample work in that area, and I was admitted, and because of it, this is where my career was solidified and continues today in public health nursing. During the winter months, some years ago in Kentucky, she gathered a group of faculty. We were confronted with a muddy lake with no water because fall and winter had been very dry. The group made their own sunshine. We looked at beautiful pictures of the lake, and we returned home with a new program. She is a very passionate individual. She is gentle and kind in working with others. She attempts to bring out the best in others, and then she works with it. So I think that really is the reason why she's deserving of this award.
Well, good evening, everyone. I hope each of you who chose to join us tonight will accept my appreciation for your presence. I remember when Angela McBride, who I've always viewed as a very creative person, was president of the Academy over 20 years ago and came up with the concept of the Living Legend Award and the celebration. At the time, I thought it was a terrific idea, but I never dreamed I would be among those honored in such a manner. I wonder how this did happen. Well, I know parts of it. Actually, the Academy provides this unique platform and framework, but my colleagues' efforts, combined with the Academy Board's decision-making, really made it happen. And I'm grateful for that, and I especially want to thank those colleagues who developed materials supporting my nomination. Those people are Polly Bednash, Julie Sebastian, Marcia Stanhope. I also want to thank Nora Warshawski, who organized the effort, and our dean, Janie Heath, who encouraged and supported the nomination. And of course, I want to thank the board, who made a good decision. I have been very fortunate to have had a long career, which has been and continues to be very interesting, lively, and at times rather challenging and certainly fulfilling. But it has been a career that has had a little healthy dose of controversy, which has been particularly interesting and stimulating. And it would not be possible without the support of many. Most importantly, my loving and supportive husband, who happens to be a philosopher and has never, ever been rattled by any of my doings. Also, it would not have been possible without the advantage of outstanding teachers, mentors, role models, and colleagues with whom I have partnered and worked shoulder to shoulder on my journey. These individuals have inspired me, challenged me, nudged me, at times pushed, and even seemed to pull me, and always encouraged me to move forward. I especially want to pay tribute and publicly express gratitude to several mentors I encountered during graduate study in the School of Nursing and the School of Public Health at Chapel Hill. It was really a phenomenal experience. These people had a profound impact on me during those formative years and throughout my career, and still, even to this day. Dr. Margaret Shetland, Professor Margaret Dolan, Dr. John Castle, Dr. David Jenkins, Dr. Cecil Sloan, and Dr. Cecil Sheps. I also want to pay tribute to Doris Swartz, a public health nurse, a remarkable professional who was quite unique among her peers in public health nursing because she conducted and published a number of studies in the late 50s and early 60s about problems experienced by the elderly. Actually, I remember a paper I read when I was either in the latter part of my undergraduate program or in graduate school, when Doris Swartz described how she used McBee cards to help analyze her data. Does anybody remember McBee cards? There's a hand here. That's great. So in graduate school, I learned more about her work and certainly admired her for it. And as I mentioned, my career has been such that I have encountered a little bit of controversy in working on some of the things that I really cared about. And one of those times when I was working with what was called the Primax Nurse Practitioner Program at Chapel Hill and doing some descriptive and evaluative studies associated with the program. That was in the early 1970s when a number of nurses and nursing faculty throughout the country were not on board with the development of nurse practitioners. At that time, I met Doris Swartz, who is co-directing the FNP program at Cornell New York Hospital, and had the opportunity to work with her. That was very special and led to the development relevant to tonight's event. One afternoon in the middle 1970s, I was sitting in my Chapel Hill office, and Doris Swartz called and told me she wanted to sponsor me for a fellowship in the American Academy of Nursing. I was completely floored and remember saying to her, "I'm really honored by your offer, but I'm not ready for that." She tried to persuade me, and finally she said, "Think about it and let me know your decision." It didn't take me too long to get a grip on the situation and call her back and say, "It would be absolutely wonderful for you to be my sponsor." And so it happened, and I became a fellow of the Academy. And I'm so grateful to Professor Swartz for her confidence in me and the opportunity of fellowship in this body. I began my career, as Dr. Stanhope said, as a public health nurse in 1961, carrying a black bag and driving around a rural Texas district in a 1949 Ford without air conditioning. Unfortunately, the faithful car did not last long. Among the many things for which I was responsible was conducting well baby clinics, which provide very general assessments of growth and development, health teaching, and immunizations for babies and young children. At scheduled times, a volunteer physician might show up, but many times that did not happen. And the reality was that frequently many of the babies were not well. The families were poor, and there were very few options for a more thorough assessment and for care. There, I personally encountered the reality that gave rise to the development of pediatric nurse practitioners and the evolution of the nurse practitioner movement in nursing. And through a variety of experiences where I saw major gaps between what was and hoped for, I began to consider there should be a different reality, and I decided that things needed to be done. I concluded I should go to graduate school and be a part of the change that needed to happen. And in graduate school, I had another epiphany, the need for research to provide better evidence for decision-making in practice. That led to a decision to proceed straight from my master's onto a PhD in epidemiology. And that was a controversial decision, but a good one. And I've tried to think back over my career, which has been varied in some ways, although I've only really worked in three major settings after my doctorate. But within those settings and working through a variety of organizations, I have been involved in a number of activities for which I feel very fortunate. So the arc of my career was such that it can be described as beginning with a clear focus on research and knowledge creation. But over time, my emphasis shifted to more of a focus on working with others and using the best evidence possible to effect positive and sustained change in nursing practice and nursing education. And because I believe it's so very important, along the way I've also tried to look to the future and find ways to provide guidance and support to students and mentees. Some of the problems and issues that I've been passionate about and have worked on with others have been mentioned. My efforts to reframe public health nursing practice to include a serious focus on community-level efforts and the use of epidemiological approaches in the area of population health. Improving access to primary care through enhancement of nursing practice in community settings, which includes but is not limited to the nurse practitioner, development nurse practitioner practice and nurse-managed clinics. Research development in schools of nursing as a necessary condition for strong PhD programs. Development of faculty practice in schools of nursing to enhance the education process, provide strong role models for students, and increase clinical scholarship. Improving the transition of new baccalaureate graduates into practice in community health through community health nurse internships and the transition into practice in acute hospital settings through residency programs. And finally, strengthening of leadership in all areas of nursing practice through the development of strong DNP programs. I have a special commitment to this because it was about 18 years ago that I led my faculty colleagues at UK in developing the first practice doctorate in the United States designed as a second-degree doctorate in nursing practice. And it was 16 years ago when we admitted our first students to that program. I credit our successes with the program to those colleagues and others who have joined us, some of whom I am pleased to say are here with me tonight. I am so thankful for them. In closing, I want you to know that I consider this award a phenomenal gift, an affirmation beyond measure bestowed by professional peers in this very unique organization. I will cherish this award, the memory of this event, those who have shared it with me, and all who made it possible. Thank you.
Our fourth living legend to be recognized this evening is Nancy Fugate Woods. Another former president of our Academy, Dr. Woods, is an internationally recognized women's health expert and a strong voice for diversity in nursing. We take it for granted today that women's health is deserving of intensive research. When Nancy Woods became an advocate for scientific research into women's health, such research was far less visible or acknowledged. Through her research, publication, and advocacy over the decades, Nancy Woods explored the many dimensions of menstruation, and particularly menopause and its implications for a woman's mental and physical well-being. Because of her research, we know much more about the importance of human sexuality and premenstrual distress, symptom clusters and menopause biomarkers, the variability of hot flash symptomatology among women, and the prevalence and impact of depression during menopausal transition, and much more. Dr. Woods' advocacy skills on behalf of women's health through her many influential committee and professional organizational positions greatly extended the impact of her 175 publications. Whether as a chair or a member of influential committees and organizations, Nancy Woods insisted that women's aging and women's health be made a priority and that it received recognition for its importance to half of the population. Her advocacy and leadership, including her time as president of our Academy, helped usher in a paradigm shift in which nursing research in particular and medical research in general broadened its gaze to include the unique healthcare challenges faced by women. Perhaps less known, but even more courageous, is the forward-thinking approach Dr. Woods displayed on diversity in our profession. In 2001, as Dean of the University of Washington School of Nursing, she offered a public apology for the school's history of not admitting African American and other underrepresented students. She used the occasion of an African American nurse's public reading from a book she wrote about Seattle's first African American nurses to make the apology, which not only acknowledged a painful past, but also proved to be a catalyst for positive improvements that have led to efforts to create a diverse, equitable, and inclusive environment for the school. Dr. Joan Shaver, one of Dr. Wood's sponsors, will tell us more.
I've known Nancy for most of my academic career. She and I were classmates in our master's program at the University of Washington. We became fast colleagues ever since. Nancy's a very special kind of person. She is a phenomenal scientist, scholar. She is a wonderful mentor for many, many people. She's a leader who reshapes systems and organizations, and she's got a genuine caring humanism about her. Nancy has always been an inspiration to me by virtue of the way she can take diverse amounts of information, synthesizes or distill it down to make it applicable to healthcare and to nursing and to make it understandable to so many people. She has been a mentor to countless numbers of people in our field, but has taken the message of our values and perspectives in nursing to other fields as well. But she also learns from others at the same time. A good example of how Nancy tries to make the world a better place is that she commits her musical talent to many of our gatherings. So in many a reception, Nancy has played the piano. She's a wonderful pianist. She tells us that she earned part of her college education money by playing a piano in some local watering holes. She runs and gets a large container and labels it tips and puts it on the piano. And I think she's raising scholarship money for students. When people in the future look back on the development of women's health knowledge for nursing and for healthcare, the name Nancy Fugate Woods will be extraordinarily prominent. Nancy had her early education in Wisconsin, so this is close, and let me paraphrase Garrison Keillor. When you enter Nancy's sphere of influence, it's welcome to Lake Wobegon. Nancy Fugate Wood's contributions are strong. Her team and colleagues are good-looking, in productivity that is, and the nursing and healthcare outcomes are way above average. Tonight we are honored to position you front and center, to honor you among us as a living legend. Through your leadership, fabulously has our profession ascended.
Well, you cannot imagine how it feels to be on this stage with the women who are here with me tonight. And also, I can't tell you how wonderful it is to be here in this room with all of these incredible people, and including so many friends. So this is a very special moment. I'll have to say, it all began in 1946 when my parents began imbuing me with the value of higher education. That was a constant theme in our family, and in addition to that, my mother managed to get a college degree in the middle of the Depression. My family is still debating exactly how our grandfather managed to finance that. We don't really know. We are very, very grateful, I think, for the socialization that we had in our family with respect to the social responsibility that we had. And my parents have really given me a great gift. However, my current and wonderful support, who's here with me tonight, Jim Woods, who is, you can stand up. Who has been a constant source of encouragement, a wonderful support, and often a wonderfully leveling critic, as only your husband or possibly your partner or your child might be, and just sort of letting you know when you've sort of bumped up against the limits. Jim has had a wonderful career as a bench scientist, and for many years was employed by the National Institutes of Health. He was of invaluable support to those of us as we work to think about what a National Institute or National Center for Nursing Research at NIH might look like. And someday, when we have more time, I can regale you with those stories. The really incredible part of the relationship, and tonight is really all about relationships. The incredible part of the relationship that I've come to enjoy with Jim would not have been possible without Joan Shaver. And then I'm also reminded that it was Linda Cronenwet and Elaine Larson who are in part responsible for the fact that I met Jim. As a graduate student in my first semester, I was overwhelmed and in awe of these incredible women because Joan, Linda, and Elaine and I were all part of the same master's degree cohort at the University of Washington in 1968. By the end of the first quarter, I was quite convinced I had no business being in that graduate program. I had gone over to meet with one of my professors to talk about whether I should stay out for a year and have more practice experience. Well, to make a long story short, the professor was not able to meet our meeting, and so I went to the coffee shop to have a cup of coffee, whereupon a young man in a white lab coat walked in and said, "Do you mind if I join you?" And there was no one else there, so I said, "Oh, of course not." Well, about 2 hours later, he said, oh, I have an experiment running. I need to go back up to my lab. And I said, oh, I should probably get on with, my appointment. And then I thought, maybe I'll go back to graduate school for just one more quarter. So that was December 19th, 1968. We were married on December 20th, 1969. And Elaine Larson gave me a bridal shower. So how's that? Now this gets better because on the way to coming back to the University of Washington to serve on that faculty, I lived in North Carolina. I taught nursing at Duke University. Thank you to Ruby Wilson for taking a chance on me. And I had an incredible opportunity to have Carolyn Williams on my PhD committee in epidemiology. So how lucky can you get? I had a wonderful time working with Carolyn. She understood exactly what I was attempting to do. I think that there were some other members of my committee who thought it was a little bit beyond the pale of what a good epidemiology study would be. But then when I heard Elaine talk about her experiences tonight, I didn't feel so bad. Carolyn was a wonderful support. And even more interesting is that Pam Mitchell, who's sitting down here at the UW table, gave me a phone call one day. I was sitting in my office at Duke University writing a paper, and she called and asked me if I would like to come and interview for a position at the University of Washington. And all I could think of was, Jim just had gotten promoted to this permanent position at NIH. We were going to move wherever we were going to go together. And when I went home and talked to him about moving, he said, you go interview. You need to go see what's possible. And, we can do this. So we did. And the rest is history. So thank you, Pam, for getting us back to the University of Washington. It's been a wonderful place for me. There are some incredible people who aren't here tonight that I need to thank. One of them is Ellen Mitchell, who has been almost a career-long collaborator. Ellen was a pioneer in developing a primary care practice, in interdisciplinary practice between a nurse practitioner and her husband, an internal medicine physician. Ellen's specialty was in women's health. And as I had come to the University of Washington to do that work, she joined me first as a PhD student and then stayed on as a lifelong collaborator. She and I are still working together. We say that our collaborative relationship has extended longer than many US marriages. The amazing thing, of course, is when these people are still speaking to you after working with you all of these years. I have, in addition to thank, in addition to the people I've already named, many people I haven't, and I wouldn't be standing here tonight were not for Carolyn Williams, I've already mentioned, but in my master's program, Marjorie Beatty, who is a pioneer in the development of nursing research and the structural support for that in schools of nursing in the US, and Carol Lindemann, who was my undergraduate professor, who said, I think you should go to graduate school. Now, I had no idea what that was, but I went home and talked about it with my mother, and she said, you should do that. I am grateful for many of the students from whom I have learned a great deal, and some of them are here tonight, and some of my younger colleagues who have taught me a great deal are here tonight. Diana Taylor, who is well known for her work in women's health advocacy, was an early PhD student. She had already, by that time, started a clinic specializing in women's health and menstrual disorders at Oregon Health Sciences University. And I asked her what she thought we might be able to do together that would be useful to her, since I thought she already knew a lot more about the territory than I did. In addition, Lori Trigo, who is here this evening, who has studied women in the military and looked at deployment challenges women face, Jeanette Taylor and Joanne Banks, whose work has been really a paradigm shift in looking at African American women's health, taught me more than I can ever imagine. Barbara Silko, Annette Thomas, Barbara Cochran, Chiang Cha, who's off at Ewha Women's Health University, Ewha University, excuse me, Mani Arpalantikul from Thailand, Kathy Smith DeJulio, Lori Cray, and many others whom I've not mentioned this evening were sources of incredible education. So I guess my message here would be that it works both ways, and it works for almost an academic lifetime to have these relationships and to learn so much from the people that you're working with as students and colleagues. Finally, I want to thank the people who have had the patience with me in my development as a clinician, the patience with me as I developed my role as an educator, and the encouragement and patience with me as I developed as an investigator. And I thought I had retired on July 1st, but I went to a workshop this morning on pragmatic trials, and I thought, maybe just one more study. So Jim, we'll talk. Thank you all.
Our final living legend to be recognized tonight is Connie Yarbrough. Connie Yarbrough. Connie Yarbrough has made amazing contributions to the field of interdisciplinary cancer care, practice, and research. The word pioneer was never more fitting. Ms. Yarbrough pioneered the role of the oncology nurse by establishing one of the first oncology nursing practice programs at the University of Alabama at Birmingham Comprehensive Cancer Center in 1972. While there, Ms. Yarbrough and Dr. John Durant established the first physician-nurse practitioner patient care model in cancer care. Also that year, Ms. Yarbrough developed the first statewide chemotherapy program based at UAB Comprehensive Cancer Center. Ms. Yarbrough was one of the first nurses to establish guidelines for care, delivery of chemotherapy, and management of side effects. These efforts set the cornerstone for the next 40 years of oncology nursing. Today, patient support groups are customary, but in 1970s, that was not the case. At the UAB Cancer Center, Ms. Yarbrough supported the development of the first cancer patient support group, and notably, she had the patients develop their own program. From the beginning, she was patient-focused and promoted shared decision-making, which are integral to cancer care today. The Oncology Nursing Society has been a central part of Ms. Yarbrough's career. She and a small group of colleagues conceptualized what became the ONS in the early 1970s. At first the ONS treasurer, she laid the groundwork for the organization's financial stability. As the second president, Ms. Yarbrough led the organization in developing practice and education standards and chemotherapy guidelines which continue to guide the practice of oncology nursing. During her tenure, the groundwork was laid for the formation of the Oncology Nursing Certification Corporation and the Oncology Nursing Foundation. On the international stage, Ms. Yarbrough has served on the board and as president of the International Society of Nurses in Cancer Care from 1991 through 2004. She has given many invited presentations to international oncology nursing organizations, and with her colleague, Karen Mensis, she developed a Train the Trainer program in breast cancer that has reached nurses from 20 countries. Through the years, she has still found the time to contribute heavily to the oncology nursing's knowledge base through 14 textbooks and 33 volumes of seminars in nursing, in oncology nursing, the journal she founded in 1985. Her textbook, Cancer Nursing, Principles and Practice, is considered the Bible of the field. Without Connie Yarbrough's vision, the history of oncology nursing might be quite different. She truly has made a phenomenal, positive impact across all spheres of oncology nursing. Dr. Karen Meneses, one of Connie Yarbrough's sponsors, has more to add.
Connie is one of those extraordinary people that has an amazing talent for connecting with people. She started as one of the very first original members of the Oncology Nursing Society in 1975. And the organization has grown to well over 39,000 members today. She also was one of the very first people to examine practice and looking at practice to make it even more excellent and establishing standards for oncology nursing practice. In addition to that, she has led so many books as far as editor and has mentored countless oncology nurses and other nurses in the profession for at least 35 years. She has had impact individually on nurses, on groups of nurses as well. She has also led and nurtured organizations. Connie's biggest quality is her patience. And in addition to that, she has a terrific sense of humor. So when she critiques with a smile. And you get it. She invited me to be a guest editor of one of her journals. And I thought, okay, this is terrific. It's a step up for me because I now have to recruit other nurses to write and to edit their work and to critique with a smile as well. She has helped us to translate what we do on a day-to-day basis and make those standards of care for practice and to improve oncology care, not just here in this country, but around the world. Way back in 1998, she received a small grant to help to develop nurses and to train nurses in breast health and breast care. And the goal was to help to deliver good breast health care to nurses around the world, particularly those who are from underserved countries. So we started a program, and it was every 2 years for 8 years. We trained 40 nurses across 20 different countries. And they, in turn, in returning back to their countries, to develop a breast health program or breast cancer care program to well over 1,400 people. And they also trained well over 900 nurses and physicians in their own country. I think back to the very first time that she started the nurse practitioner oncology practice. That was in my state where I live now in Alabama. And it was through the Comprehensive Cancer Center at the University of Alabama at Birmingham. And her work there continues to this day. I didn't know all of those things that she had done in my current institution. She's had hands across the world. She's developed cancer care globally. And I think because also oncology nurses are the ones who have given the predominant amount of that care, that she has touched the lives of really literally thousands, if not millions, of patients with cancers around the world.
Madam President, fellow living legends, fellows and guests, it is just such an honor. I am so humbled to receive this award and be recognized by the Academy. When I received an email last year from Karen Meneses, who along with Debbie McGuire and Brenda Nevijan, wanted to nominate me for this award, I responded, "Are you serious, Karen?" She responded, "Of course, while you're living, LOL." Thank you, Karen. Your rapid professional growth to our profession has been amazing. It has been a delight to work with you over the past 27 years, nationally and internationally. Debbie, thank you for nominating me for the Academy, along with Ada Lindsay in 1996 when I became a fellow. It has been such an honor to work with you, to watch your amazing research over the years, and especially work with you on numerous publications and books. Thank you, Brenda. Your administrative skills are amazing. And as CEO of Oncology Nursing Society, I am so glad you are advancing our future in oncology. Your nominating letters were so special and made me reminisce about my 47 years as an oncology nurse. My mother was a nurse, and my journey in nursing was greatly influenced by her as a role model. I remember as a child, she would stop and make a house call on my way to school, or the challenges we would discuss when she was executive director of a VNA. She would be so proud of me today. Thank you, Mom. In 1971, I began my long and rewarding journey in oncology nursing. Oncology nursing as a specialty did not exist, and medical oncology as a specialty was just beginning. Thus, we evolved at the same time, and teamwork in clinical research and trials required close collaboration between medicine and nursing. I remember calling colleagues around the country asking them, how are you dealing with this or that problem regarding patient care? The only way we were learning was by attending physician conferences or telephone communication, which ultimately led 4 of us to move ahead and establish the Oncology Nursing Society. In 1975, I am not sure we had the vision of what ONS would be 43 years later, 40,000 members. We were just concerned about meeting the needs of the patients and cancer nurses at that time. The 70s was a time when there were no chemotherapy guidelines. We mixed drugs over the clinic sink. There were no masks, no gowns, no gloves. Zofran did not exist. And we had to try different drugs to treat patients' nausea and vomiting. It was frustrating to help patients deal with their side effects when so little was known about preventing or alleviating them. However, we learned together. I was amazed at the patient's strength and the way they coped with life and death. I was providing care to them, but they were teaching me so much about living and dying. Several years ago, I received an award at the University of Alabama School of Nursing, and a patient I treated in 1975 attended. He is now married with adopted children and still working with cancer patients. As the years have passed, my life has been blessed with many mentors and nurses that I continue to admire and respect for their many achievements. I became involved at the international level in the early 80s and later president of the International Society of Nurses in Cancer Care, following in the footsteps of Vernice Ferguson. Many of you remember Vernice. She was always available with her sage advice and wisdom. I would like to thank the many colleagues who have supported me through my professional life. I can't begin to name all of them, and many are here in the audience. There are ONS past presidents and many guest editors and authors I have had the fortunate opportunity to work with. I want to thank Cindy Cantrell, who is here today, and one of the founders of the ONS with me. A close friend, a colleague for the past 45 years, and the sister I never had, who continues to advance oncology nursing and patient care. My husband, John, couldn't be with us tonight. Not only my husband, but my friend, mentor, counselor, wise teacher. He taught me about medical oncology, but I sure taught him about cancer nursing. I remember discussing with him the need, back in the 80s, for a topical oncology nursing journal. And he said to me, well, Connie, just write a proposal and submit it to the publisher. That began my role as an editor in 1984. I accept this award on behalf of all cancer nurses. I wouldn't be here today if it wasn't for their contributions and efforts in supporting and promoting cancer nursing and cancer care. Thank you, everyone.
Our newest living legends. So, I'll see you all back here tomorrow morning at 8:35 for the next panel. So you have a little more time to enjoy a great evening. We'll see you tomorrow. And congratulations again.